Most people often ask me how I got involved in all the things I do, so I thought I'd tell you. When I was an intern, I attended the Medical Association of Georgia's annual meeting, and one of the intense issues that was being debated was that sexually transmitted diseases needed to be taught in medical school. Well, I stood up in a room with just a handful of people and told them I'd never seen syphilis or gonorrhea except in a textbook. The resolution passed, and they sent me to the AMA to speak to the same issue. And again, it passed. And within 6 months, every medical school in this country was encouraged to include sexually transmitted diseases as part of their core curriculum. I learned that one person can make a difference. Whether it's in medical policy or in medical practice, and I learned that I could make a difference in medical practice when the National Health Service Corps sent me to Biola Battery. It's a pretty place, but it's a poor place. I found a community of working poor, too poor to afford medical care, but too rich to qualify for Medicaid. I liked the people, I liked the community, and I wanted to practice medicine there. So I quickly learned that practicing medicine wasn't just sewing up the shark bites. I had to deal with the land sharks, the regulators, the reviewers, the red tape dispensers, and what I sometimes call the hammerheads, the lawyers. But I had to keep involved, keep active in organizations like this one, any organization that would help me help our community. And so I also learned that there were things that my prescription pad just wouldn't take care of. Clean water, clean air, those things are really important to our patients just as much as writing a prescription for a blood pressure pill. I had a patient, Donna, who was about 26-year-old, young white girl with 2 kids. She had seizures. And so her seizures were under control until one day she came in and she said she had started having seizures again. And I said, Donna, what happened? And she said, well, I have patients draw things for me. So she drew it out. She drew her pills, what they look like. They used to be striped, but now the pharmacist gave her a different pill. Because at that time, Medicaid had gone to an HMO, and they changed her medicines to a generic. She didn't know which pills to take because she couldn't read. And that's how I knew that prescription pad wasn't enough. Another patient was Willie, and Willie was 40-something years old, born with a speech impediment and didn't really go to school, so he was considered a little slow, but he would do anything you asked him to do. You say, Willie, don't eat the fat and grease. He would do exactly what you said. But he worked as a handyman, and he cut his hand, which and got infected, had to go in the hospital. When it was time to let him go, discharge him, the social worker, who happened to be a Catholic nun who wore her habit, asked him, Willie, is there something we can do for you? You need a home health nurse? What is it? And he said, can you teach me to read? I knew that we had to do something in the community to get adult literacy taken care of, more than my simple prescription pad could do, and more than we could do alone. You needed other organizations, the entire community to come together. And the last patient I want to tell you about is a Mrs. Smith. She is 40-something-year-old, short, African-American woman who works in our school system as a janitor in the custodial services. She had what we call a slip disc or ruptured disc and was having back pain. She called me on a Saturday and she says, Dr. Benjamin, I could hear the pain in her voice. She says, Dr. Benjamin, I really tried. I went to that specialist you sent me. I've been trying to lose weight, like you said. I really am. But the pain is just too bad. Can you get me something stronger than this ibuprofen? So I told her I'd give her a prescription. I called it in and told her to come and see me. This was a Saturday. Said, come and see me Monday or Tuesday. And on Tuesday, sure enough, I walk in the exam room, and she's there standing, leaning over the exam table in a lot of pain. And I said, well, how are you? And she says, I'm still hurting. And I said, well, did the medicine help you? She said, well, I didn't get it. And I said, why? She says, well, I didn't have the money. said, but you have insurance. You have the school. You have insurance. Yes, I know, but I didn't have the copay. But I promise I'm going to get it on Friday. I get paid Friday. I promise to get it. So I stepped out of the room, asked my nurse to go over to Jim, our pharmacist across the street, and get her medicine for her. She brought it back, and I gave it to her, and her tears rolled up in her eyes. And she says, oh, Dr. Benjamin, I just didn't want you to do that. I'm so embarrassed. I'm so embarrassed. And then I realized I had made a mistake. It was a cultural mistake. I took her dignity from her. I really shouldn't have done that. And even if you have the same race, you can still be culturally incompetent. So I had to backpedal and try to get out of that one. So I basically said, well, you know, it's okay. We have a small pot of money. People donate money just for this. And if you want to put the money back on Friday when you get paid, it's okay. And she was fine with that, and she was okay. And as I was walking out of the room, like every doctor in here will know, she says, oh, by the way. We know something's coming up. So I said, sure. She said, can I ask you something? Sure. She says, well, I need a work excuse to go back to work. I said, sure. You know, she's still leaning over the table in pain. And I said, sure, you want to, today is Tuesday, you want to get your medicine, stay home a couple of days and go back on Thursday or Friday? She says, oh no, we have to strip those floors tonight. I've got to go to work tonight. These are the people who are keeping the floors for our children clean. These are the people that we're fighting for health reform. We know about the uninsured, but we don't often talk about the underinsured, people who are keeping our entire country going. So as you talk this week, people like her are the people who need you to advocate for them. So I hope you will continue to do the advocating for people like Mrs. Smith. As America's doctor, I'm proud now to move from Viola Battery to maybe open a satellite office in Washington, if you will, to welcome 300 million Americans as my new patients. I'm actually looking forward to partnering with the APHA and with dedicated health professionals and public health professionals across the country who are committed to the art and science of medicine and the betterment of public health. Prevention has been the foundation of our public health system, and it's the core of the work that we do in public health. Prevention is also going to be the foundation of my work as Surgeon General. Prevention at all levels, primary, secondary, and tertiary prevention. Everything from educational campaigns to healthy activities to innovative, complex, interventional preventive procedures. Prevention at all levels. I will also work to promote the work that you do. Many Americans simply don't understand what public health is. They often think it's just a clinic, but we know it's much more than that, just as that video just showed us. And so I want to make sure we get our message out as to what public health is. I plan to utilize the 6,000 members of the United States Public Health Service Commission Corps, and hopefully you as well, to get this message out. People really do need to know what you're doing and what you do every day, and they need to know what their role is to help us have a healthier nation. And so, as we work, thank you. Over the next few years, I promise to communicate directly to the American people on issues of public health, and I will do my best to represent you well. Thank you again, and I look forward to a wonderful and inspiring meeting. Thank you.